It's a very complex but vital question because obviously the hard endpoint that really convinces regulators and agencies and government agencies is visual acuity and prevention of visual loss. To have visual acuity and prevention of visual loss as an endpoint, either you have a trial at stages of retinopathy which are advanced, so at high risk of losing visual loss, we're talking about proliferative retinopathy or macular edema, then unless you have an effective treatment, you have visual loss within a matter of months or a few years, and so you have enough statistical power to use that as an endpoint. When you're dealing with prevention of retinopathy, then retinopathy is takes such a long time to develop, and luckily not every patient develops the very severe stages, that if you used visual acuity in a primary prevention trial, you would need tens of thousands of patients for 5 to 10 years, and nobody can possibly support a study like that, so you need surrogate endpoints. So the surrogate endpoints that are mostly used are the progression of diabetic retinopathy measured on the ETDRS scale, and there are a number of measurements, 2-step, 3 steps, one eye, both eyes, and so on. They are accepted endpoints by FDA accepts them, and the EMA accepts them as endpoints. They are pretty difficult to assess, because you need the complicated 7-field stereo photography of the fundus to collect the data, and then you need a specialized reading center for quantifying retinopathy, and then you have the problem of a continuous disease that progresses. Unlike cardiovascular trials where you have an endpoint that can be either an myocardial infarction or revascularization, or you have a date for something to happen with retinopathy, or you have an interval between successive photographs that are taken. So retinopathy of a certain stage might have occurred at any time in that interval. That makes things even more complicated. So to make it short, retinopathy is a difficult complication to target with a trial, because it's takes a long time to develop, needs thousands of patients to be enrolled, and needs a very sophisticated way of measuring it.